Sisters and brothers, I want to say first off to the organisers of tonight's event, what a fabulous event you put on behalf of your community, on behalf of all of those unfortunate people out there who require home care in this community. I also want to say and make special mention of Local 4800, if I can be partisan for just a second, about the clerical workers who work so diligently behind the scenes and are not always recognised for the work that they do in bringing home care services to all of our communities. But I also want to say to you that we need to be clear in what we're asking for at this demonstration and any future demonstrations that we engage in over the next couple of weeks and months to put the pressure on the McGuinty government. I want you to keep in mind what we're talking about here is the introduction of the marketplace into the public healthcare system. The CCAC model, which basically governs home care in this province, which has introduced the private competitive bidding model into healthcare, is also exactly the same model that they're using for LHINs. Just replace the CCAC with LHINs, and you've got exactly the same model for hospitals and long-term care facilities in this province. And that's why the Harris, I'm going to say Harris, it's the same difference, the McGuinty government, that's why when they did an analysis a couple of years ago on the home care bidding system, they decided to keep that model because they knew that it was impossible to be going two ways at the same time. They could not be killing competitive bidding in the home care sector at the same time as they're going to be promoting it for long-term care facilities and for hospitals through the LHIN system. And that's what we have to keep in mind. And that's why when we had some previous speakers make mention of the fact that the issue is the managed system, like Helen is, it's the competitive bidding model that we want to get rid of, sisters and brothers. That's what we have to kill. It's that whole notion that somehow you've got to bid against each other, and it's the dog-eat-dog mentality of the low-paid worker with no pension plan and no benefits. It's what's driving the CCAC model and competitive bidding. And I need you to understand as well that it's a complete and total oxymoron for one moment to believe that somehow bringing in 8 private sector corporations to do the work of the VON and St. Joseph's Home Care is somehow more productive. Think about this for a second. Right now you've got a non-profit organisation, 2 organisations, St. Joseph Home Care and the VON, both of them doing it on a non-profit basis, being replaced by 7 or 8 corporations who will have 7 or 8 CEOs, 7 or 8 financial officers, 7 or 8 frontline supervisors, 7 or 8, you name it, sucking money out of the healthcare system. We estimated out of the billion-dollar industry, $250 million are going into salaries of the frontline senior management across the province and their profits. Being sucked right out of the healthcare system. That's what we're fighting against. And I want to finish up by saying, my friends, I know there's been a lot of fiery speeches here today, but let me tell you where we got to get fired up. This is fantastic that this fight is taking place in Hamilton tonight, because before you, down in Windsor, they lost the VON. Where I live out in the Oshawa region, they lost the VON. Kingston, they lost the VON. And the question is, are we going to draw a line in the sand here tonight in Hamilton? Are we going to export this demonstration